Hey everybody, John Ryback and Scott Baker at the Wellbridge Clinic here today. We are here for your well-being, and today we want to talk to you about cupping. Cupping is become rather famous. You know, you've seen a lot of Olympic athletes like Michael Phelps. You see some of Hollywood's latest and greatest stars walking down the red carpet with cupping. Today we want to talk to you about cupping for people that have concussions or whiplash, neck pain. You might have been in a car accident. These are all great situations for cupping, just to name a few. And I know from personal experience that cupping is amazing. And I just had an opportunity yesterday to sit down with Scott, and he did some cupping for me on my back. And so today I'm going to take a rare opportunity for you all. I'm going to take my shirt off, and we're gonna see what this does and why. So we both like to play really hard. All winter, all summer, we're either skiing, running, biking, playing. I know in the last year alone, I've gotten 2 really bad cases of whiplash and a concussion that was really highly unfortunate. And what I get is I get foggy brain and I get neck pain, difficulty twisting, checking my blind spot when I'm driving. Scott and I were talking about it. He gave me a cupping session. So today I want to have Scott tell you about cupping because it's really amazing and there's a lot of misunderstandings about it. And this is what it looks like. So let me show you. So with cupping, you get these marks, and I'll let Scott tell you all about it now.
So a lot of people are curious about these red marks. Typically, you'd be at the gym, walking around stores, John said, down the red carpet, and people have these red marks after cupping sessions for a couple of reasons. Oftentimes people are nervous to try cupping. They're either turned off or afraid it's going to be painful, because it looks like pretty intense bruising. But there's a reason for all this redness in the tissue. So when we put cups on tight tissue, what we're doing is trying to release these myofascial trigger points, these clusters or muscle knots, if you will, of tight fibers, tight muscle tissue that's basically stuck together. Many of you probably have experienced that tension, that soreness kind of up around the upper back, along the neck, as John was saying. With concussions, we see this a lot with whiplash, upper back pain, sitting at a desk. Basically, when that tissue gets chronically tight and it becomes tight and sore because you're getting nerve compression from that tight tissue pushing down on the nerves. So again, with the cups, what we're doing is we're putting it over those regions of really tight, constricted muscle fibers, and we're separating them apart. Think about a bowl of spaghetti that you just cooked and then you rinse it off and you let it sit and cool, and it gets sticky. It's tough to work with. With the cups, what we're doing is basically separating all those noodles back apart, so then they increase their functionality and they increase their ability to contract and relax as muscles should. But also, they then are able to get better blood movement through that tissue. So when tight tissue is locked up, it's impinging on all the vascular tissue in there. So you're getting very poor blood movement in, which decreases the amount of oxygen into the tissue, but also very poor blood movement out, which means that the cells, which are still metabolizing, aren't having the ability to drain that metabolic waste that's built up. And the redness that you see from these cupping marks is mostly broken down blood cells that have been stuck in that knotted up tissue. So again, with the cups, we separate all those fibers apart and then thereby liberate all of that metabolic waste, those broken down blood cells, out of the tissue up to the surface, so then John's lymphatic system can drain all of that stuff out. So when you put the cups on, oftentimes what you'll see is these concentrated circular areas where tissue had been more stuck, more tight, and had locked up more of that metabolic waste. And then in those focused areas, once we open the tissue up, that can then drain more effectively, getting fresh blood and fresh oxygen into the tissue and then clearing out all of that old cellular debris. But we don't just leave the cups in one place. This is kind of a common misunderstanding. There's something called static cupping, where the cups are oftentimes just left in one location over a muscle knot. But here what we do is a lot more movement with the cups. Oftentimes we'll also have patients walk through range of motion with a limb or with their neck as we're doing cupping. So we're much more dynamic with the tissue. We're putting them on specific regions where there are clusters of muscle knots, but we're not only working in that area, we're working along the entire region of those fibers, up the shoulder, up the upper back, up the neck. And you can see in John here where some of those runs where he had really tight trapezius muscles had a lot of stagnant blood along there. And then in some of the areas over by his scapula here and here, he had also really stagnant tissue there, poor blood drainage, and we were able to concentrate in those regions. So what we're trying to do here is explain the hows and whys of cupping so it lands a little more familiar with you. And if you are experiencing any of that upper back pain, neck tension from either an injury, a car accident, or even just sitting at a desk for too long and getting tense, cupping is a great therapy to help pull a lot of that tension out of there, clear out a lot of that metabolic waste, and then thereby alleviating a lot of the pain. So come in and join us at the Wellbridge Clinic. If you have any of those upper back issues, concerns, we're happy to do cupping sessions. We typically do acupuncture first to kind of set the tissue up, let it soften up, and then we'll finish with a good cupping session once the tissue's nice and relaxed.
Yeah, and quick question. So will these marks be, if you cut me again, what will they look like?
Yeah, I'm glad you brought that up. So once you see this kind of discoloration, usually it's the first and second maybe cupping session because a lot of that stuff is stuck in that tissue. But after a couple of days, maybe a week or two or so, this will all start to fade away as the body's lymphatic system drains all of that stuff out of it. You got to stay warm and you got to stay hydrated to keep the tissue nice and dilated, nice and open so you can get that good drainage through there. But in subsequent cupping sessions, the degree of dark redness is depreciating. It's decreasing because we're getting the tissue to stay open. We're getting better blood flow through and better blood drainage out. So he's not building up as much of that metabolic waste in that tissue as possible.
Yeah. I hope that's helpful for y'all. It's so important, especially for concussions, which are really difficult to treat unless you're using acupuncture and the full tool set that acupuncturists have. Because like Scott said, as you draw out and increase the circulation, it increases circulation in the areas above and below and around because it keeps the flow going. So some of the things that you'll really want to make sure that you make an appointment for is if you or somebody you know has gotten in a car accident or if they've gotten a concussion, you know you've heard time and time again the importance of getting concussions taken care of. It's really crucial, and this is one of the most important therapies that you can use. I hope that's really been helpful for you. It's our pleasure to be of service, and we're always excited to help you and help you understand how acupuncture and Chinese medicine really work and why in modern terms. That's Scott and John over at the Wellbridge Clinic. We're in Portland, Oregon. Take a moment to click like on the bottom of this video and so we can share this with more people like you that want to get better and stay better. Thank you.
Take care.